Good afternoon, guys. Give me 1 second to set up for the show, and I'll be right with you. Let me back up a little bit. Okay, today's discussion has to do with the regrowing cartilage for joints, injectables for regrowing cartilage for joints. So here we go with the presentation I made for you. Please enjoy. Okay, Stanford scientists report that blocking a single aging related enzyme 15 PG D H through targeted injections enabled substantial cartilage regrowth in aged mice and prevented arthritis progression after ACL type injuries. The findings challenge the long held belief that adult cartilage cannot regenerate and suggest that joints may have dominant repair programs that can be reactivated. How the treatment works and why it matters. The biological target 15 PGDH. The enzyme becomes more abundant in aging cartilage and breaks down prostaglandin E2 or PGE2, a natural molecule that signals the body to repair joint tissue. When 15 PGDH levels rise, PGE2 can't accumulate, and the joints build in repair system. Essentially shuts down. The mechanism in plain language. The researchers describe 15 PGDH as a cellular bouncer that blocks the repair signal from entering the joint. The inhibitor injection fires that bouncer, allowing PGE2 to circulate freely and activate repair pathways. That were previously suppressed. This reframes cartilage damage not as irreversible wear and tear, but as a blocked healing process that might be reopened. Why this is a big deal? For decades, clinicians have assumed that adult cartilage has almost no regenerative capacity. This study suggests the capacity exists. It just inhibited by aging biology. This is a profound shift in how scientists think about arthritis and joint degeneration. Evidence reported in the article. Regeneration in aged mice. The treated mice didn't just show small improvements, they developed dramatically thicker cartilage across entire, entire joint surfaces. Something researchers did not expect to see in older animals. Protection after injury. The mice with ACL type injuries, which in humans often lead to arthritis within 5 to 15 years, twice weekly injections prevented or slowed arthritis progression. This suggests the therapy might not only repair existing damage, but also interrupt the cascade that leads from injury to chronic joint disease. Expert commentary. Senior scientist Helen Bowell called it a new way of regenerating adult tissue with significant clinical promise. A strong statement from a lab known for pioneering regenerative biology. Practical clinical application or implications. Non-surgical regenerative option. The biology translates to humans. This could offer an alternative to joint replacement surgery or microfracture procedures which attempt to stimulate limited repair but often produce inferior cartilage. treatment for both aging and injury-related arthritis. Because 15-PG D H rises with age and after trauma, the therapy could theoretically help older adults with degenerative arthritis, younger people with post-injury cartilage loss, patients hoping to delay or avoid knee replacement, a broader regenerative medicine insight. The study hints that other tissues once thought non-renewable might also have hidden regenerative programs suppressed by aging enzymes. This could influence research far beyond orthopedics. Important limitations and cautions still in the preclinical stage. All results so far are in mice. Many therapies that work in rodents fail in humans due to differences in immune response, joint biomechanics, and metabolism unknowns that must be addressed. Optimal dosing and frequency, how long the effect lasts, whether blocking 15-PGDH has unintended consequences in other organs. Whether PGE2 overstimulation could cause inflammation or abnormal tissue growth, how the therapy interacts with existing arthritis medications, timeline to human use, even with strong results, moving from mouse studies to FDA approval. Treatments typically takes years of safety studies and phased clinical trials. Practical takeaway: the core insight by blocking the enzyme 15-PGDH, Stanford researchers restored natural repair signaling and triggered shrinking cartilage regrowth in aged mice. This opens a promising path toward regenerative arthritis treatment, but human benefits remain unproven until clinical trials begin. If you're dealing with knee pain or arthritis, a healthcare professional can help you understand current evidence-based options while research like this continues to evolve. From mouse studies into first in human trials. The text refers to a study showing that blocking a single age-related enzyme P15 PG D H through a targeted injection can make older knee cartilage behave young again. The surrounding page content deepens this by explaining how the injection works, what changed inside the cartilage cells, and why this challenges long held assumptions about joint degeneration. What the scientists actually did. Researchers at Stanford Medicine found that aging cartilage contains high levels of an enzyme called 15 PGDH, which destroys prostaglandin or prostaglandin E2, PGE2, a molecule that helps tissue repair itself themselves. In older knees, this enzyme rises and if effectively shuts off the joint's natural repair signals. By injecting a 15 PGDH inhibitor, they prevented the enzyme from breaking down. PGE2 with the repair signal restored. Existing cartilage cells chondrocytes began rebuilding the joint surface. This is important because it means the injection doesn't add new cells. It reprograms the cells already in the knee to act young again. What happened in the mice? The treated mice, even very old ones, showed thicker cartilage layers across the entire knee, not just at the injection sites. Reduced inflammation and fewer breakdown oriented chondrocytes. More cells shifting into repair mode. Less pain, less arthritis progression after ACL type injuries. The regrowth was strong enough that researchers described it as shrinking and unexpected in age animals. What happened in human tissue samples? Human knee cartilage removed during joint replacement surgeries was exposed to the same inhibitor in the lab within a week. 15 PG D H levels dropped. Breakdown signals decreased. The cartilage's structural scaffold began rebuilding. These samples came from end-stage arthritis, so seeing any repair at all is notable through lab results. Though lab results can't predict full healing inside a living joint. Why this matters. The study challenges the long-held belief that adult cartilage cannot regenerate. Instead, it suggests the capacity for repair exists. Aging biology suppresses it. A targeted drug could unlock that dominant ability. If this translates to humans, it could eventually offer a non-surgical option to delay or avoid knee replacement, a way to protect cartilage after injuries like ACL tears. A regenerative therapy that pairs with physical therapy or surgery. What still needs to be proven? The article emphasizes that this is early stage research. Mouse joints heal faster than human joints. Dosing must be carefully tested. Long-term durability and safety are unknown. Too much signaling could cause unwanted bone growth or stiffness. Human trials are required to see whether injections work inside a living knee. A related oral drug, MF300, has passed phase 1 safety testing for other conditions, but cartilage-specific trials have not yet begun. The core idea in one line: blocking the aging enzyme 15 PGDH reactivates the knee's natural repair program, allowing old cartilage to regrow in ways previously thought impossible. What research steps complete be, must complete this before this could ever become a treatment for people? Okay, that is B for you. I will be back on with C shortly. Give me a bit to put that together for you, and I'll be back on with C for y'all. For now, Gator Wellness. Take care, folks.